That's the group. That's the group. Thank you. Thank you very much. This really is the group. What a great group of people. And they're not even doing it for the party. They're doing it for this country because we suffered with Obamacare. I went through 2 years of campaigning, and I'm telling you, no matter where I went, people were suffering so badly with the ravages of Obamacare. And I will say this, that as far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident. Your deductibles, when it comes to deductibles, they were so ridiculous that nobody got to use their current plan. This non-existent plan that I heard so many wonderful things about over the last 3 or 4 days after that. I mean, it's, I don't think you're going to hear so much right now. The insurance companies are fleeing. It's been a catastrophe, and this is a great plan. I actually think it will get even better, and this is, make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it. Make no mistake. And I think most importantly, yes, premiums will be coming down. Yes, deductibles will be coming down. But very importantly, it's a great plan. And ultimately, that's what it's all about. We knew that wasn't going to work. I predicted it a long time ago. I said it's failing. And now it's obvious that it's failing. It's dead. It's essentially dead. If we don't pay lots of ransom money over to the insurance companies, it would die immediately. So what we have is something very, very incredibly well crafted. Tell you what, there is a lot of talent standing behind me, an unbelievable amount of talent. That I can tell you. I mean it. And, you know, coming from a different world and only being a politician for a short period of time, how am I doing? Am I doing okay? I'm president. Hey, I'm president. Can you believe it, right? I don't know. I thought you needed a little bit more time. They always told me more time, but we didn't.
Republican plan will offer instead tax credits based on a person's age, and this could be a really big problem for people because if the cost of coverage in their area is very high, the tax credits don't adjust like the Obamacare subsidies. A lot of provisions in this bill. There are a lot of provisions in this bill. It's very comprehensive, but it will do a lot of things to knock down Obamacare. It's going to change the subsidies that Obamacare now provides to help people pay their premiums. Those subsidies are now based on a person's income and, very importantly, on the cost of the premium in their area. The Republican plan will offer instead tax credits based on a person's age, and this could be a really big problem for people because if the cost of coverage in their area is very high, the tax credits don't adjust like the Obamacare subsidies do to cover that. Another big change that the Republican plan would enact is that right now there are ironclad protections for people with pre-existing conditions under Obamacare. The Republican plan would allow states to waive out of some of those provisions. So insurers could charge people more based on their health history, and they could also not cover all of the treatments and services that some people with pre-existing conditions need. So Republicans, instead of offering these benefits for people with pre-existing conditions, they're going to bring back high-risk pools, which were very common before Obamacare. But they were expensive. They charged oftentimes double the premiums. These high-risk pools in the past, before Obamacare, were chronically underfunded, and states had to put in billions of dollars in order to, make them solvent. So the high-risk pools are going to be a very expensive option. So insurers under Obamacare are required to cover 10 essential health benefits. These include prescription drugs, substance abuse, mental health, maternity. Under the Republican plan, states can opt out of requiring insurers to cover all of these benefits. So it'll depend on where you live. It'll be very unequal coverage. One of the other major changes is to really overhaul Medicaid. The Republican bill will eliminate funding for Medicaid expansion. It's likely that as people fall out of the program, states are not going to sign up new people. But even more so, and I don't think a lot of people recognize this, it would actually fundamentally change the traditional Medicaid program, which now covers more than 70 million people. That's about 1 in 5 Americans are under Medicaid, and it is going to change that program radically. The Congressional Budget Office expects that federal support for Medicaid would be cut by 25% by 2026. That is going to be huge. And the states are going to have to deal with this lower funding from the federal government. So they're going to have to curtail benefits, curtail eligibility. So there are going to be a lot fewer people on Medicaid. One of the most hated parts of Obamacare is the individual mandate. That is going to go away. So you will no longer be required to get coverage or pay a penalty. Employers who have more than 50 workers are also required to provide affordable coverage for their workers. That also goes away under the Republican plan. There were a lot of taxes associated with Obamacare to help pay for it. All of these go away. Under Obamacare, there was an historic drop in the uninsured rate in America. That's very important to note. And under the Republican plan, it's very likely that that number is going to be reversed.
It's one vote away now. So the pressure on those 5 Republicans, one of them has to walk the plank. Let's listen in.
Oh, there it is.
They hit 216.
That's
they
it.
hit 216 votes.
They can still change their minds, but as of right now, the 216 number has been achieved. The Republicans will declare victory at this stage. The president just tweeted, by the way, if victorious, Republicans will be having a big press conference at the beautiful Rose Garden of the White House immediately after the vote. And it looks like the Republicans have it.
Yeah, they did, and it looks like those 2 Democrats who had looked like they voted for it changed their mind, probably a mistake there, and we'll see what this president says in terms of the messaging. It's a big moment for him. So many doubts in those first 100 days that he could get something done, and now he has.
All right, let's listen to the floor of the House.